Well, after the holidays, you might be considering cutting back on alcohol or doing what's called dry January. So consumer insight group Vailink says more than half of Americans want to reduce their alcohol intake. And a study published in the British Medical Journal shows people who give up alcohol for 1 month had significant health improvements, losing an average of 4 pounds. One woman we talked to said she's trying it, noticing a huge difference, hoping the lifestyle change continues.
I just felt like my drinking was getting, I guess, a little more than I was comfortable with it being. I'm looking for a lifestyle change that I can keep with me forever.
So joining me now is Dr. Jody Ryan with Well Power, giving us some insight on how to be more mindful in the new year. So thank you so much for being here. We appreciate it.
Thank you. Thanks for having me.
Absolutely. Tell us about dry January, kind of the benefits. They are beyond your health too.
Yeah. For decades, people have been cutting back on their alcohol around the New Year's, right, as part of their New Year's resolutions. And around 10 years ago in the UK, they started a public health campaign called Dry January as a means of helping people be much more mindful about their relationship with alcohol and to help people cut back. And that's really taken off. And so much so that around 35% of American adults will be participating this year in Dry January. And there's lots of health benefits for people to be more mindful of their alcohol intake and for cutting back.
And there's also, too, Doctor, a thing that people are trying called Damp January. What is that?
Yeah, damp January has been a recent phenomenon. I think that it stems from around a fifth of millennials and around a quarter of Gen Zs have really found it difficult to stick with dry January, right? And so really it's going from, am I going to stop drinking altogether or am I going to cut back? And so damp January is really trying to be a lot more compassionate for those where it's challenging, and yet there's still health benefits from people cutting back. So if your goal is to cut back, right, and if I'm a daily drinker, I might go from, instead of drinking every day, to drinking one less day per week. Or if I'm a weekend drinker and drink Friday and Saturday, I may cut back and only drink Friday instead of both Friday and Saturday, sorry. So really it's trying to get people to change the relationship, whatever that is, from either stopping completely or just cutting back a bit.
Which makes complete sense. And we have to ask you, too, what is your biggest advice for those trying to stay the course, right? It's really festive, plenty of opportunities to be social. Yeah. What would be your biggest advice for those who are doing dry January or damp January?
Right. Even after the holidays, it's still festive.
Yes.
I would say that, find the why and make the why personal. Do I want to lose weight, as you alluded to at the beginning of the segment? Or do I want to save money? Or do I want to sleep better and have more energy during the day? Or do I want to have less blackouts or wake up with less hangovers? And all of those are valid reasons, right? And are really important and really personalize this experience. And then the second is set your goal, whether you want it dry or dry-ish January and you want to just cut back. Share your goal with somebody. I think sharing is really important because it helps people stick to that commitment, and you revisit your goal on a weekly basis. And then finally, just to have self-compassion. So let's say you have a day when you're not able to achieve your goal, be okay about it and think about, well, maybe I need to reframe that and then start over the following day. Your diet, so to speak, isn't ruined with one donut, and to really roll with things.
That is great, and that accountability is everything, too. Like you said, Doctor, thank you so much for being with us, taking the time. We have all your health interviews, including this one, at cbscolorado.com. Karen?